Hey, what is up, guys? And welcome back to Confessions of a Doctorholic with your girl, Dr. Slayman. Today's theme, one word, conflict. Okay, maybe two, conflict and transfers. But honestly, it was giving who's going to take responsibility for this patient energy all night. Let's talk about the chaos. So here we are, middle of a regular call shift. The emergency department sends an epic message to one of my teammates. The message? Super vague. Possible cholecystitis consult. You know, just the classic, maybe they have gallbladder disease kind of ping. We open up the chart, scroll through labs, and immediately red flags. The patient's ALT and AST are both over 7,000. Not 70, not 700, 7,000. That is screaming liver injury, and their total bilirubin was 12. Just to put that in context, with your typical cholecystitis, bilirubin might be 1 or 1.5, maybe 3 max. But if they've got something benign like Gilbert syndrome, which makes your bilirubin spike a bit under stress, but 12, that's like this patient needs a hepatologist yesterday. So now I'm thinking, okay, this isn't a gallbladder problem. We pull up the imaging, no gallstones, gallbladder not inflamed, bile ducts not dilated. So what is this? It's not surgical, it's not biliary. It's looking more and more like primary liver pathology, hepatitis, or some other medical process. So we do what we always do in these situations. We call the ED back, and that's when things get spicy. The ED attending that night, known for being aggressive, condescending, and honestly kind of unprofessional. I've had enough encounters to know you have to brace yourself when calling her. So we politely tell her, hey, we reviewed the labs and imaging. This isn't surgical. This is more of a medicine consult. They need to work up liver pathology. Her response, I'm not consulting medicine unless you drop it first. And I'm like, wait, what? And then she says, well, I don't just consult medicine. I'm not going to unless you guys come and see them. This is not a game of surgical chicken. She then threatens to escalate and says we need to immediately speak to our attending. And I'm like, okay, we were going to go see the patient anyway. We're just giving you a heads up not to delay care. So now it's the morning. This is a non-urgent consult, by the way, because the patient's stable. We hadn't even laid hands on the patient because, again, not surgical, but we still pre-charted, reviewed imaging, explained our reasoning in detail in the chart, and went to the patient and also explained to the patient what we were thinking. And guess what she does? She writes an aggressive note in the chart, screenshots our communication, and basically tries to throw us under the bus, saying we refused to see the patient and left a plan without evaluation. Except we did see the patient, and our plan was very clear. We explained the reasoning behind why this isn't a surgical issue and why medicine needs to take over, not dismissive, not lazy, just factual. So finally, we stuff it with our attending and he goes, oh yeah, the ED called me overnight. I told them it's not a surgical case. He literally validated everything we said. He may have used some colorful language when they woke him up at 2 a.m., but hey, he backed us up. And it turns out that's likely what pushed them to transfer the patient to main campus for medicine to take over, which goes to show sometimes being right still feels like a fight. We continued to follow the patient and we gave our main campus colleagues a heads up just to let them know that this patient's coming in and they may be consulted at some point. The patient was transferred under the assumption that he needs a liver transplant. That wasn't the case. This was an acute change. He was stable at bedside and he likely needed an ERCP, which is why we wanted medicine to have a look at him, and particularly the gastroenterology team. Confession. Being a resident means constantly walking that line between advocating for what's right for the patient and not stepping on egos. And sometimes, even when you're right, you've got to brace for the fallout. Until next time. Follow me on the gram on @Hafsa Slayman, or chat with me on Threads or the Tube. Catch yous later. Follow me on the gram or on Threads on @Hafsa Slayman.